Well, October is Breast Cancer Awareness Month, and while women who have a close blood relative are at a higher risk for breast cancer, most women who get the disease do not have a family history of it. And here to talk to us more about that is Dr. Catherine Ansley, an oncologist with Wake Forest Baptist Health. Good to see you.
Thank you. Thanks so much for having me.
All right, so now can you talk a little bit about why mammograms are so important? Let's start there.
Yes, of course. So with this being October, we do want to raise awareness for getting your annual screening mammogram. It is so important because most importantly, they save lives. We know that women who get a mammogram every year have a better chance of finding the tumor smaller than if they were to wait until you could feel it later and it got bigger. So smaller means easier to treat, easier to cure.
All right, talk to us about this family history when it comes to breast cancer.
Well, of course, family history is important in breast cancer. If you have a family history, such as your mom or your aunt or your sister who has breast cancer, we definitely encourage you to get your screening mammogram every year. But it is important to remember, like you said, that actually most breast cancer is not hereditary. 1 in 8 women will get breast cancer, which is not a small number. I mean, I think we look around and we all know 8 women. So to think that one of them, of our friends or family, could get breast cancer, most of the time it's not hereditary. Actually, 90% of the time it's not. It's only about 5 to 10% of the time that it's someone that is hereditary and linked to a gene. Most of the time it's just bad luck. But if we find it early with a mammogram, most of the time it's curable.
So if you had a sister who perhaps had breast cancer, does not necessarily mean you'll get it? Or?
Yeah, correct. If you had a sister who had breast cancer, hers could have been what we call sporadic, which means it was just bad luck. Still, you should get your mammogram every year starting at age 40, like we encourage all women to, or 10 years younger than she was diagnosed.
All women get similar treatment?
You know, so I think that's important to remember, is that all breast cancer is not the same. In fact, it's a whole host of different diseases. Women come into my office and think that they'll get the same treatment their neighbor or their sister got. But in fact, their tumor could be very different. Theirs could be driven by estrogen or an antibody called HER2. So we do want to raise awareness that some breast cancer needs chemo, but a lot of it doesn't. A lot of
treatments have changed, right?
A lot of treatments have changed. Now that we have what we call targeted therapy, finding those specific receptors, each patient is unique and individual, but now their treatments are too.
All right, good stuff. Thank you so much. We appreciate you.
Thank you.